Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Nadeem Dhanani. He's joining us here as Medical Director of Urology at Modernizing Medicine. He's going to discuss their platform, how it can be used to improve certain practice aspects. He's also going to talk a little bit about all-in-one systems and how they can streamline workflow and efficacy, improve patient engagement, especially among younger patients. Welcome to Health Professional Radio, Dr. Dhanani. Thank you for taking the time.
Thank you so much for having me, Neil. Good morning.
Give us a bit of your professional background. Of course, I mentioned your position there at Modernizing Medicine. Talk a little bit about yourself.
Certainly. Well, thank you. I am a practicing urologist. I have a background in urologic oncology and also have always had an interest in promoting efficiencies in healthcare through different workflows and minimizing practice pattern variations. Once I finished my training at the National Cancer Institute, I was practicing in Boston and had, in those practices, had introduced various levels of technology throughout the healthcare practice. And right around that time is when I was introduced to Modernizing Medicine, and started to learn about the really exciting advances that they were doing, taking a very proactive approach into the introduction of technology into healthcare, which at that time was very much a response to regulatory mandates as opposed to really exploring what the power of technology could do. And what was refreshing at that time when I was introduced to Modernizing Medicine and shown their platform and what it was that they were envisioning, it really showed how they were looking to be at the forefront of what could be done in this space. So that's the point I decided to join in, and I've been excited and pleased by the journey ever since.
Does Modernizing Medicine's platform include just telehealth, maybe social media or remote monitoring?
Absolutely. So one of the exciting things about Modernizing Medicine's platform is that it really is all-encompassing. If you look at the history of the company and the history of the technology, it started off to address a specific need, and that was that there were these mandates to have electronic documentation of your clinic note. And at that time, paper was still by far the fastest way to document a note. What we realized is that there was so much technology that if used appropriately, it's no longer an obstacle to care. It's no longer a given that, well, paper is fastest. Now, how can you minimize the additional time that you have to add on by using electronic formats and using that technology? And so to embrace it really organically, to have a efficient, informative, constructive note, and what that experience looks like is what the initial focus was. But then the evolution started along with the industry itself, right? To understand the fact that it's not just documenting the note, but it's how do you aid in that interaction? How do you use it to help build rapport with your patient? Sure, there's value to not having to look at your keyboard or have your back to the patient while you're typing a note, right? So the handheld, the mobile devices, having that ability in that interaction helps. The ability to draw on this to help with that communication as you're explaining technical healthcare concepts. That was incorporated. And then the ability to now say there is an entire ecosystem which is helping to navigate this relationship, whether it's from the first time a patient reaches out to you or learns about you. So like you mentioned, through social media, through electronic and mobile communication back and forth, scheduling that first appointment and the consultation, communicating the important intake of information. All of that is now part of our platform as well. The revenue cycle management, the practice management, all of these things are things that over the past 8 or 10 years, we've now started to grow to really optimize from the initial touch point to the continued relationship management long after that visit. to bring both quality of care and optimize that, as well as that patient experience. So yes, it's a large suite of offerings that Modernizing Medicine has.
So it would seem that legislation said this is what you'll do, and it's up to you to figure out how to make it work within the industry. And it seems that that's what Modernizing Medicine has done, has made it so that you take all of this huge amount of information that is now being easily gathered and use it to make the patient outcome much more favorable.
You know, you're absolutely right. When you look at the things that, you know, for example, when I was in medical school, and by no means do I want anyone here to think that I'm so ancient that that stuff is no longer relevant. But it's just a function of the healthcare information and the data that we are generating on a daily and hourly basis. Right, a small fraction of what I learned in medical school is what I'm doing as a healthcare provider today. And so, how do we use the information that's available in a digestible way? How do you actually incorporate that to make the quality of medicine better, to provide point of care access to that data that is easily digestible and usable to help inform our decisions? That is really what the opportunity is. And then how do you actually help create access? Right? We know one of the huge barriers to healthcare quality is simply access. How do you improve that access? Right? Should it have to be where somebody makes the choice between their job or their health? Well, you know, I can't take additional time off, so I guess I have to miss that appointment. That doesn't have to be the case. We have technology where you and I are communicating right now, at very different parts of the country and the world even. And those barriers don't have to be there. And also, you know, that the access to healthcare in real time is so important. It doesn't really do us any good to have to go back and say, hey, let me look that up and get back to you in a week. So being able to infuse that information and going beyond just the documentation requirements, but embracing the technology and the opportunities that lie ahead. That's truly, I mean, you know, without trying to sound cliche, that's really modernizing medicine. And that's what we do. And that's exciting.
Do you see this explosion in telehealth, remote monitoring, remote scheduling as a result of the pandemic? Do you see it scaling back, leveling out, or continuing to soar as technology advances?
You know, I think that it is only going to get more vital to our practice. I think that pandemic certainly accelerated the role of technology and telehealth. But what it did was it really caused the industry to have to accept this technology that has a very vital role, right? I mean, when you look at healthcare today, there is so much that is driven by a patient's story and by objective data that we get, whether it's imaging, whether it's lab values, whether it's genomics. All these different types of things are things that inform the decision. Less and less is it about, well, I have to have the patient here in front of me. By no means am I in any way saying that that's not an important part, right? Relationship building, that trust is extremely important in quality healthcare. And that's something that we never want to take away. But it doesn't have to be an either or. It doesn't have to come at the expense of that convenience and that access. So if we're able to keep patients out of healthcare environments when we don't want them to be, for example, a post-operative setting, right? You've just operated on somebody, they've gone through, they've been discharged from the hospital, their mobility is impaired, logistically it may be difficult, physically it may be difficult for them to get into, and you just need a touch point. You need to be able to check in on them and make sure your questions to make sure that they are in a safe zone, make sure they're answered. You don't need to bring them in and inconvenience them or have to jump through hoops to see you. You certainly don't want to bring patients in that are maybe immunocompromised at a certain point in their treatment, to bring them into some place where germs are, you know, just by definition going to be higher concentration. And obviously in a pandemic, you don't want to draw them in. So I think it's here to stay. I think it's a welcomed opportunity for us to accelerate this, and I think it's only going to get better.
Where can we go online and learn more about Modernizing Medicine and the platform that you're offering there?
Absolutely. So if you go to www.modmed.com, you can really get an idea of the story of the company. You can see the different subspecialties that we are in right now, and what the future growth looks like. And certainly at any point, you can reach out, and we always have people that are available to help see if it's the right fit for a given provider or practice at their current stage, and see what opportunities are for a healthy collaboration.
Well, I appreciate you joining us here on Health Professional Radio. Dr. Dhanani, thank you so much for taking the time.
It has really been a pleasure. Thank you for your time.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Nadeem Dhanani, Medical Director of Urology at Modernizing Medicine. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.